Beginning the EKG process. First, obtain your order. Then, open the machine and turn the power on. Verify that this is the patient that you want to do the EKG on and arrow down to technician. Make sure other information is also correct. Put in your ID number. You are ready at this point. You can arrow down there when you see this screen to attach your electrodes and do the EKG. Performing the EKG. After washing your hands and putting on gloves and checking with the patient their identification as well as their wristband, then you are ready to begin placing the EKG tabs.
You are now ready to begin the procedure. Identify the site of attachments for the electrodes accurately, and at these sites prepare the skin. This is required to ensure good contact and therefore produce an artifact-free and accurate ECG trace. Incorrect placement of the electrodes produces diagnostically significant differences on the ECG, and as a result, patients can be treated incorrectly. Ensure the centre of the electrode is located in the appropriate position. First, attach the electrodes for the limb leads. There are 4 limb leads. The electrodes are located one on each of the limbs as follows. On the lower limbs, attach an electrode proximal to each ankle, and on the upper limbs, attach an electrode proximal to each wrist. Now move on to attach the electrodes for the chest leads. There are 6 chest leads. To locate the positions for these, use the sternal angle as a reference point to count down the intercostal spaces. The second intercostal space is directly below sternal angle, and from here you can count down to the 3rd, 4th and 5th intercostal spaces. The electrodes are located across the chest wall as follows. For lead 1, labelled V1 or C1, the electrode is located at the 4th intercostal space at the right sternal edge. For lead 2, labelled V2 or C2, the electrode is located at the 4th intercostal space at the left sternal edge. For lead 4, labelled V4 or C4, the electrode is located at the 5th intercostal space at the mid-clavicular line. For lead 3, labelled V3 or C3, the electrode is located midway between V2 and V4. For lead 5, labelled V5 or C5, the electrode is located to the left anterior axillary line on the same horizontal plane as V4. For lead 6, labelled V6 or C6, the electrode is located at the left mid-axillary line on the same horizontal plane as V4 and V5. In women, the electrode should be placed underneath rather than on top of any breast tissue.
When holding the electrodes, when they are facing you, work from the outside in. Taking this outside wire, you see that this goes to the right leg. On this outside one, you see that this goes to the left leg. Separate the 2 compartments there with your thumb. Let the rest just dangle to the side rail. And taking the longest wire, attach to the right arm. In numbered order, you will start 1 to the right, 2, 3, take your second set. Your longest wire will be left arm. Again, numbered order. You're continuing 4, 5, and 6. You are now ready to print your EKG. Looking at the EKG machine, if your rhythm looks good, then you hit the ECG button. It will freeze the picture. If you like that, hit ECG again. If you don't, hit the cancel button, which will be located at F2. The screen will resume its tracing. When you like what you see or the color button is green, hit ECG again.